My name is Matt Greco. For those of you who don't know, I'm the events manager at PSS Life University. Today, we're very pleased to have Dr. Elizabeth Chuang present to us on caring for yourself while caring for others. Dr. Chaung is the director of the Montefiore Einstein Center for Bioethics in the Bronx. And before that, she practiced palliative medicine for 10 years at Montefiore. Her research focuses on doctor-patient and family communication during terminal illness. So she's going to present to us today. If you have questions, please put them in the chat or the Q&A, and Dr. Chuang will answer most of those toward the end of her talk. And we may have a short presentation at the end from our Circle of Care people. And with that, I'll hand it over to Dr. Chuang.
Good morning, and thank you for that introduction. I have been practicing palliative medicine for a number of years here, and in that capacity, I had the opportunity and the honor to accompany many caregivers in their journey of caring for adults facing serious illness. And I'm going to talk a little bit about some things to think about as you may be experiencing or in the future experience a role as a caregiver of someone with advancing or serious illness. And I'll start by pointing out that caregiving is really a journey. It's a new phase of life, and it can be scary. It can be full of unknowns. But it's a journey that about 17% of the U.S. adult population is taking at any given time, caring for adults with medical needs. Being a caregiver can have significant health and psychological effects on the caregiver themselves. At the same time, it can be a deeply rewarding time of life. And one of the things that can be challenging about it is that you don't really know where the journey is going to lead. For some folks, it may be a long-term role as a caregiver, and for others, it may be a shorter period of time, and it may be hard to know that as you're beginning your journey as a caregiver. So it's one of the things that's important about becoming a caregiver is to think about creating a caregiving team. Remembering that caregiving is physical, emotional, and spiritual journey, and it's hard work. Remember that you're working hard, and think about taking care of yourself as well. So as you're creating your caregiving team, this is really the time to pull in the assistance of friends, family, support groups, networks that you might have through your religious affiliations or community affiliations. It's not the time to try to show your strongest face and not ask for help when you need it. It's really the time to kind of pull in all of your support system that you can. And one of the things that can be helpful is identifying really concrete things to ask your network to help with. So, for example, identifying a specific caregiving task or block of time to request that people help you with. And this can feel like an additional amount of work that in addition to caring for your loved one, to think about what kinds of tasks you can ask people to do or to create a schedule. But putting in that additional work up front can really help people to help you because folks may want to help, but they really don't know what they actually can do. So if you identify ahead of time what specific tasks you need help with, or a time when maybe you need to go to a doctor's appointment, or there's something important that you need to accomplish, or even going to the grocery store, or just having some time to yourself, you can have those times blocked out and be ready when somebody asks, what can I do to help? Being as specific as possible and not being afraid to ask again. Just because someone says, I'm sorry, I'm not available at that time, or I can't do that specific task, may not mean that they don't want to help. It may just mean that you need to identify another opportunity for them. And then remember that your own doctor can be part of your caregiving team, and make sure that you mention your caregiving role to your own physician, because respite care may be available, and it's just important for them to know what you're facing in terms of evaluating your own health needs. Some sort of concrete things. One thing to do is to think about your living space. If you're living with somebody that you're taking care of, there's specific things that you can do to make things easier for both yourself and your loved one. And I'm just going to go room by room in your home, and starting with the bathroom, because the bathroom is a place where it can become more and more difficult to maneuver, and where you need to accomplish important tasks. So doing things like investing in a shower seat, a toilet seat, an adjustable shower head, and grab bars, and non-slip, sorry for the typo there, non-slip mats and rugs in the bathroom can reduce the physical demands on you as you're helping your loved one, and also help them be more independent in their own bathing and toileting, and avoid falls. Moving on to the bedroom, making a clear and easy path from the doorway to the bathroom, moving electronic cords and cables out of the way, and keeping daily items within reach. And the reason that these things are important, in addition to the items that I talked about in the previous slide, is more than 1 in 4 older adults fall each year, and about 20% of those falls can cause serious injuries such as broken bones and head injuries. So making sure that your space is easy to navigate and has physical aspects that can reduce the likelihood of a fall, and again, making things physically easier to maneuver. Making sure if you still have a landline, that the landline phone is next to the bed in case of emergency, and making sure that copies of emergency numbers are easily available and within reach in case of a fall, or in case of another emergency or difficulty getting out of bed. Managing your kitchen space, making sure you have a working smoke detector and fire extinguisher. Those are important for everyone, but especially important if you're caring for a loved one, for example, who may start having cognitive decline. It's not uncommon that somebody may forget to turn off a stove or leave something cooking, causing a small fire. So making sure that you're able to be alerted to that quickly and address it. Thinking about things like replacing breakable dishware with hard plastic, so that if there are issues with dexterity and something might be likely to drop something, that it's not going to break. So some simple things to make it a little bit easier. Again, in your living room, as I said with the bedroom, clearing pathways to important places in the space of electrical wires and other items on the ground that are trip hazards. One of the biggest hazards actually in the home is rugs. So making sure that all the rugs are secured. You can get adhesive tape pretty cheaply that just tapes it down to the floor, so you don't have the corners sticking up, as you see in this picture, causing a fall hazard. So then moving beyond outside of your physical space, taking care of your loved one and making sure that they stay active as long as possible can help to help them stay as independent as possible, and slow the physical decline that may be accompanied by their illness. So simple things like taking a walk, listening to music, and dancing can be very effective ways of getting somebody up and getting them more active. Music is something that touches everybody at all walks of life and can be very rewarding, and encouraging people to get up and get moving. Making sure that you're visiting places that are familiar and pleasant, as people, particularly with mild cognitive impairment or dementia, start to have issues with memory, that can be very disconcerting to them, and they're comforted by going to places that are familiar to them, where they don't have to navigate a new environment. And for similar reasons, eating and sleeping at the same time every day can be very helpful to keep routines going. keep the person calm, keep the person feeling secure. And then finally, visits with children or pets can be very rewarding for people and help them stay connected and feel comforted. So one of the things that is difficult for many adult caregivers, if you're caring for a close family member, is taking care of the personal hygiene aspects of care. And maybe a role that's new for us and can bring up feelings of discomfort, of embarrassment, and we may not be sure how to navigate that with, for example, aging parents or a sibling or somebody that you wouldn't have in the past been responsible for bathing or personal hygiene. So the first thing is to let the person wash themselves as much as they possibly can, with you helping with the areas that they can't reach. Let the person use their own strength to lift them up as much as they possibly can, and limiting the amount of work that you're doing trying to lift them yourself to sort of limit the strain on your own physical health and the danger of lifting somebody that may be too heavy. Making sure that you have all your supplies ready to go and within arm's reach so you don't have to leave the person. Really having an open and honest conversation with your loved one about what they are and are not able to do, understanding that they may be experiencing discomfort or embarrassment as well, trying to help them bathe while being as modest as possible and only doing what is absolutely necessary. Being patient and respectful and avoiding sudden or jerky moves that could startle them, causing either them or you to slip in the bathroom. Those are some sort of basic tips there. I talked a little bit about staying physically active and some tips for doing that. It's also important to try to stay cognitively active and stimulated, again, to preserve memory, to preserve abilities. Some activities that may be pleasurable for both the caregiver and the person facing illness is going through old photos, creating scrapbooks, sorting and organizing things, doing puzzles or card games, creating art or reading a book together. All these activities can be very soothing and calming and help to keep the mind active. Next, I'm going to talk about some behavioral issues. And again, the physical issues that are most difficult for caregivers are, and as I said, things around bathing and personal hygiene. The behavioral issues are another aspect of being a caregiver that can be very challenging for people. And it's one of the things that comes up the most when I'm talking to caregivers in the hospital setting of the things that are the most difficult for them to manage. And these behavioral issues include agitation, restlessness and wandering, yelling and screaming, being afraid or having paranoia, repetitive thoughts and behaviors that they can't seem to get out of. And as you can imagine, these are difficult for caregivers because as a caregiver, you've known this person for much of your life often. You're expecting them to behave as you remember them behaving, as your parent or as your sibling or as your family member. And these can be very disturbing and also be a little bit scary when you're thinking about restlessness and wandering, yelling and screaming. You may be worried about the health and safety of the person as well. So just acknowledging that these are things that are challenging for everyone. And here's some tips, and I'm going to spend a little bit of time with this because I think it's, again, a really challenging thing to address. So if somebody's having these behavioral issues, one of the things to do is to think about what may be triggering that behavior. Is there pain? Is there hunger? Is there thirst or fatigue? Do they need to use the bathroom? Do they have a skin irritation? Are they constipated? And some folks, as they're having decline of their brain function, they may not be able to verbalize that or say what's bothering them, and instead just have these kind of agitated behaviors. And you may need to develop what some folks call why this, try this framework for managing this. Because they're not able to communicate well, you may have a hypothesis. You may think, is this due to pain? So you check for pain, and if that doesn't seem to be the issue, are they hungry? Try to feed them. And if that doesn't help, try something new. Think of a different why. Is it a skin irritation, or is it constipation? So it's a little bit of a trial and error that, again, can require a lot of patience to kind of go through the list and think of things that might be bothering them. Other things that you can do, again, are stay in familiar surroundings and avoid sudden changes, because those can be very, very stressful for someone with cognitive issues. Creating a calm environment, allowing adequate rest, and then these last three things: try not to be confrontational, reacting to emotions, and redirecting to new activities. I'm going to go into a little bit more detail. And so some folks think about 7 steps in managing difficult behaviors, specifically for patients who are suffering from dementia. And step number 1 is reassuring the person. And one of the truths is a person with dementia can't change the way they are behaving, and you as a caregiver have to change your reaction to the environment or situation. And being a reassuring presence is the first part of that. Maybe verbalizing, I'm on your side, I'm taking you seriously, reassuring and validating their emotions. And this can be really hard, because it might be easy to feel annoyed when you've tried multiple different things and the behavior is still there. You may be embarrassed or worried, and you want to react and you want to fix it. But trying to keep yourself sort of grounded, taking a deep breath, reminding yourself this is not your loved one, it's the dementia that's causing the behavior, and approaching slowly and responding again to the emotion. So first is assuring them. Second is collecting yourself, doing whatever you need to calm yourself down. Third is approaching slowly and from the front. So you're less likely to startle them or confuse them if they can see you and you're approaching them slowly. Avoid using the words calm down, which seem like a natural response to somebody who's out of control, but can actually get them more agitated, because it can make them feel like you're not taking their issues seriously. Remember that they may be in pain, they may be afraid, and that's what's driving their behavior. So instead of asking them to calm down, you can ask them what's wrong. And even if they can't really articulate it, making sure that they understand that you're listening to them. And then fifth would be stopping yourself from reacting with logic, because you can't really reason with a person at that time, or use facts or proof to prove your point, because it just doesn't work. So set that impulse aside. And then sixth, respond to the emotion being expressed rather than the behavior. So instead of saying, don't do that, or what are you doing, focus on validating the patient's mood. So you can say things like, you sound like you're upset, or you look like you're in a hurry, or you look sad. How can I help? I know this bothers you a lot. Let me see how I can help. And just being reassuring and saying, I'm here, everything's all right. And then finally, using body language that matches your words. More than half of any message that we give to anyone is conveyed non-verbally, but it's especially true when someone has dementia. Avoid sighing or rolling your eyes, have a relaxed posture and a friendly tone of voice, which make the person more open to what you have to say. A light touch to reassure or guide can be helpful. Outstretching your hand as an invitation, but again, without any sudden movements or startling movements that could scare them. And I'm going to go into even more detail with this, specifically the idea of responding to emotion rather than trying to respond with logic to somebody who's becoming agitated with dementia. For example, they may say something, and this is just kind of a silly example, I need the car to drive to the ball, or whatever it is that clearly is not what's happening. Instead of sort of arguing with them and saying, there's no ball to go to today, or you're not able to drive, or it's not safe for you to drive, you can say something else like, I see you're really wanting the car today, or saying, I will take you in the car today to get what you need. Or another example, I didn't write this check for $500. Someone at the bank is forging my signature. So that kind of paranoia or being confused about what's happening is pretty common. So again, instead of arguing and saying the bank would be forging your signature, you can respond to the feelings by saying, wow, that's a really scary thought. I'll make sure that they don't do that. And then pivoting. So that's the last part of it. If it's something that they have maybe a repetitive thought that they keep going back to, trying to gently distract them with a new activity. Would you help me fold the towels? That might be able to get them out of that frightening loop that they're stuck in. So those are just some tips on how you might be able to direct somebody or redirect somebody who's experiencing agitation. And as you can imagine, this requires a lot of patience. And again, going back to the idea of taking care of yourself, and making sure that your health, physical and emotional needs are cared for, so that you have the patience really to implement some of those really tricky tips and managing someone's behavior. And so speaking of taking care of yourself and services that might be available, so depending on your loved one's insurance, they may be able to receive some custodial care. So custodial care really refers to the types of care that I've been talking about: bathing, staying with somebody to make sure that they're safe, feeding them, taking care of their personal hygiene. And custodial care can be provided either in the home or in a nursing home if somebody has the needs for a permanent placement. And again, depending on the insurance status, your loved one may qualify for at least some hours of custodial care in the home, and that can allow the caregiver at least some time to take care of important things like grocery shopping or doctor's visits, and just have that break of getting away from the caregiving role for at least some time during the week. Respite care may be available through the Department for the Aging, for example, and New York Connect. You can see the website and the phone number there. So respite care services provide infrequent and temporary substitute care or supervision of adults who are frail or have a disability on behalf of the caregiver, for the purpose of providing caregivers with relief from the stress of caregiving and maintain a normal life. So respite care is a little bit difficult to access, and it's only really meant to be temporary. So for example, if you as a caregiver need to go in for an elective surgery and won't be able to take care of the patient for a week or so, you may be able to access respite care briefly. Or if, again, you just need a break for a short period of time. And respite services in New York State are provided through community-based respite programs that are funded by the New York State Office of the Aging and some other not-for-profit groups. Palliative care is a service that provides an extra layer of support for patients with serious illness, no matter what their prognosis or underlying illness may be. Palliative care often in the Bronx and in New York City is provided within hospital systems for patients who are hospitalized. They can provide pain and symptom management and support for decisions that might need to be made by caregivers and the patients themselves. And for patients specifically who are facing cancer diagnoses, they may be able to access palliative care in the outpatient setting where they receive their cancer care. Again, providing an extra layer of support, social work services to help caregivers and help access services, pain and symptom management, and also help with decisions that may need to be made about the patient's care moving forward. And finally, hospice is available for patients, specifically for patients who are likely in the last 6 months of their life. And hospice can provide care most often in the patient's home, provided by a nurse visit, usually about once a week, some home attendant services for that custodial care, and then services overseen by a physician with also access to chaplains and social workers who will come into the home. And importantly, hospice services provide all the things delivered to the home that the patient would need, including medications, a hospital bed if needed, a commode. All the supplies go directly into the person's home. And they provide a 24-hour hotline if there's an emergency or symptoms that can't be controlled at that point, and the patient can be moved directly into an inpatient hospice situation if the home situation isn't working at that moment or isn't enough to care for the patient, and they can avoid going through the hospital emergency room. So that's a great bundle of care, specifically though limited for people who are really at the end of their life. I'm going to take the next little bit just talking about some things to plan for in terms of the patient's care moving forward, or your loved one's care as they may be facing serious illness. We encourage folks to think about advance directives, and really the purpose of advance directives are to make sure that the patient receives the care that is aligned with their values and their goals and their wishes as they approach the end of life period. And there's two kinds of advance directives. The most straightforward thing to do is to create a proxy directive, which formally assigns decision-making power to a trusted person. And there's two important things to note about a healthcare proxy. Number one is that the powers of the healthcare proxy only start when the person is not able to make decisions on their own. And related to that, number two is that a healthcare proxy can only be created by a person, the patient themselves, before they lose the ability to make that decision on their own. And they are the only ones who are really able to designate a specific person to make decisions on their behalf in the future. And it's important if you're helping your loved one to create a healthcare proxy form, is to really talk to them about what kinds of things that they would want for their care, so that the healthcare proxy really has a good understanding of how to make decisions when it comes to that time. The second type of advance directive is a treatment directive, which expresses wishes about the kind of care that the person would prefer in case they they lose the ability to make their decisions themselves. And that types of treatment directives may be living wills or statements that the patient made about the type of care that they would want for themselves. So other details to sort of note is that the proxy can be done. Go to the next slide and show it. So this is an example of what it looks like in New York State. This is a healthcare proxy form where you can see the patient here at the top writes their own name, and they appoint the name of the person that would be acting on their behalf, and an alternate person if the first person is not available. And this can be done without a lawyer. You just need the patient to be able to sign it and date it. And you need two witnesses, and those witnesses can't see the person that is being designated as a healthcare proxy or the secondary. They need to be independent witnesses who are witnessing that the patient was able to make these decisions on their own. And again, These forms can be gotten at a doctor's office. They can be downloaded online, and you do not need a notary. You don't need a lawyer. These are things that anyone can do for themselves. A living will, on the other hand, is usually done with a lawyer, again, detailing the person's desire for future medical care, or you might, together with your doctor, create a MOLST form that's filled out by, again, a clinician, usually a physician, in conversation with a patient or their family member about specific decisions for their care right in the present time. So a living will is more for the future, a MOLST form is for the present time. And that can be a little bit confusing, but again, the MOLST form would be something that you would do with the patient's physician, and they could go into detail and explain it to you. So finally, taking care of yourself is, again, I can't stress this enough, is the most important thing that you can do while you're taking care of your loved one, because if your health is compromised, or either your physical or your mental health is compromised, then you won't be able to provide the care to your loved one. So it's not selfish to spend some time taking care of yourself, and again, leaning on your networks to help you achieve that. And that's pretty much what I have to say about caregiving. But before I wrap up and take some questions, I wanted to spend a little bit of time talking about a research study that I am conducting currently. One of the things that I've noticed in my practice as a palliative care physician is that physicians who are caring for patients facing serious illness in the hospital sometimes don't communicate as well as we could about what's going on with a patient's condition and about choices for that patient's care moving forward. And so one of my passions as a researcher and an educator is to help train physicians to communicate better with more clear and plain language and with empathy with patients and families who are facing serious illness. And unfortunately, we do notice that sometimes there can be some bias or stereotyping that further makes the communication even poor quality, unfortunately, with patients from minoritized backgrounds, including African American or Black patients and families. And in order to really optimally train the physicians to care for people in the best way possible with the highest quality care, I'm really interested in obtaining some feedback or hearing what those experiences of communication are from the perspective of patients and families. And so in order to do that, I'm conducting some focus groups with Bronx residents who identify as African American or Black, who have had the experience of family caregivers of patients with serious illness, which you can see how we're defining that there. And what we're asking folks to do is to come for 2 90-minute focus group sessions with about 5 to 8 other participants and a facilitator, either in person or virtually. We have both options to share experiences of communication with doctors and also to have a look at the materials that we use to train the doctors in communication and let us know what suggestions you might have for improving those materials. Participants receive a $48 gift card per session. For the in-person sessions, we include some refreshments. And in order for us to adequately listen to the stories and understand what's being said, we do audio record them for analysis later. So those are all the slides I have. If you are interested in joining the focus group, you can email me at bchuang@montefiore.org or give me a call at this number. I may not answer it right away if I'm in patient care, but please leave a message and I'll call you back as soon as I can. I'd be very interested in hearing your feedback on your experiences if you'd like to join us. And I think what I'm going to do is I'm going to stop my share and see if there are questions.
Thank you, Dr. Chung. Looks like we have a quiet group today. I don't see any questions. Hopefully people will put some in. I do have a few questions I can get started with. But first of all, in reference to your research group, do you maybe after send me an email with that information, because I can put it out to the center directors for those who didn't show up today. And,
Absolutely.
yeah. All right. So listening to your talk, a couple questions in regard to family members who, say somebody's caring for their mom and they start to notice things. And, at first it's just like, okay, it's just normal part of aging. But is there a point where family members, realize there's something more serious going on, where it's not just, oh, I have to look in on mom occasionally, but there's something more serious, may require more of an effort, say, on my part or something?
Yeah, that's a great question, and I think it's one that many of us are faced with when thinking about our perhaps aging parents or other family members. What is the point at which I need to, particularly if they live a distance from us, think about as you said, checking in on them, or maybe thinking about a different living arrangement. And I would say, if you're concerned about it, if there's sort of something nagging you, having them go see their primary care doctor to have a formal evaluation could be very helpful. Montefiore does have the Center for the Aging Brain, where folks can come in for official cognitive testing and kind of see where they are in their trajectory. And certainly if there's one of the things that we do worry about a lot with older folks is things that there are unfortunately a lot of sort of scams that people try to rope somebody in to give away their financial information. So if you hear of your loved one saying anything about, they're responding to some email or some phone calls that are disturbing, that would be something that I'd be on high alert for, making sure that they're not a victim of a financial crime. Thinking about, are they, at what point are they not able to drive their car, or at what point are they having difficulty, again, with things like leaving a stove on. Those would be some of the red flags I would think about. And again, if you're able to go with them to a primary care physician visit, that's maybe the best way you can get an objective assessment of, where they are in their trajectory.
Okay, thank you. A kind of related question. I've noticed in the building that I live with, this has occurred, where there's a couple or a single person living alone, and they start to act a little erratically, and the super or the doorman has to intervene. And this happens more than once. It happens a few times, and the family seems reluctant to intervene. Is that something where it's like they have to get over that reluctance to really come to terms with what's going on?
Yeah, and I think it can be tricky because, a lot of folks whose parents are maybe reaching that stage may also be in the middle of their working career and may have dependent children. And so there may be a sort of a wishful thinking that mom and dad can be okay on their own for a little bit longer. And yeah, sort of bringing that to the attention, again, may be important. There is the option always of calling Adult Protective Services if, for example, you notice somebody in your building, or you're not the caregiver, and you don't have a direct relationship with them, to just sort of alert and see if they can come and do an evaluation. That can be kind of a more extreme end of the circumstance, but if you really think that somebody's at danger, you can alert Adult Protective Services and have them look into it.
Okay, very good, thank you. Another question. So you mentioned somebody with dementia, and then being concerned that the bank is stealing money, and that might, to the average person, that would seem a little crazy, but that the response to it doesn't necessarily seem crazy, right? If they really think that's the case, then of course they would be concerned. So are there levels of memory loss or senility that people should be aware of? Like maybe one thing is off, but the other things seem okay?
Right. Yeah. And I think, it's important to not automatically discount everything that the person is saying just because they carry a specific diagnosis, because there may be some truth to some of the things that they're saying. So it's worth looking into it. And yeah, you're exactly right. If they are concerned that somebody's in their bank account, then that would be very, very distressing. So that's why it's important to respond to the emotion and kind of take their perspective seriously, even if, for example, you're the one taking care of their financial situation. You know that it's what they're saying is not factually true. It's emotionally true for them.
Right, right. Okay, very good. Well, we do have a couple of questions that came in. The first one is, what can be done to improve hygiene problems?
Yeah, I would say, I think this is one of the things that can be difficult to broach, because there will be a point in the trajectory where the caregiver really has to take over, helping the person care for their personal hygiene, and may actually physically have to be there in the bathroom with them, helping them bathe. And that can be a very difficult subject to broach with the patient, or with your loved one, in terms of, when that's a stage where they're really giving up a lot of their dignity and privacy. So again, having a very sensitive conversation with them, and trying to get their buy-in to let you help them, and maybe, doing it in a gradual sort of process. Like, can I be in the bathroom with you and hand you, we'll keep the curtain pulled, but I'll hand you the washcloth and help you with this, and have gradually build up their comfort level with having assistance with bathing. Because if somebody's really not able to take care of their personal hygiene, then they will really need another person to come in and help them with it.
Okay, thank you. And then we have a question in the chat. Should I be concerned as a son caring for my mother that I may develop similar characteristics of dementia later on?
That's a great question, and something that certainly a lot of us are concerned about in that situation. So there can be some genetic component of developing dementia, but it's certainly not something hard and fast that if you have a family member with it, that you definitely are going to have it. If we don't really fully understand how what percentage might be related to hereditary aspects, but we do know one of the things that you can do for yourself. Again, we know that folks who get regular exercise, who are eating well, who are taking care of themselves physically and emotionally in middle age or in early older age, can reduce their risk of developing dementia later on. So the best thing that you can do to avoid that is to take care of your health now. And although, it is concerning, that it by no means is a guarantee that you will develop dementia later on. The other thing that you can do is sort of think about what kinds of care you would want for yourself, and start thinking about doing advanced directives for yourself eventually as well. But again, taking care of your own physical health.
I see another question here in the Q&A. I think it was from the same person as before. The person being taken care of does not want to bathe or even change their depends, and also does not want me to shave them. So I guess they're just wondering what kind of things they could do.
Yeah, that's a really tough situation. And I would say, I'd probably have to ask a lot more questions about the specifics of the situation. But when somebody is having trouble with even those sort of basic hygiene issues, there may need to be an escalation of sort of the level of care, the amount of care that they're getting. And at some point, they may need even more intense care, like being in a facility or a nursing home to help get that professional care, even maybe temporarily to get the situation under control.
So we did have one of the questioners say they were a son. Is normally I would think it would be more daughters helping, but in this day and age, is this more common to have sons help out, or when there's more than one child, how does that usually work out?
Yeah, so that's a great point to bring up. So we do see the majority of caregivers being women, but I think that that's changing over time, and there can be some specific challenges of that dynamic because historically men may not have been as involved in child rearing and feel as confident with some of those caregiving skills, but are very ready and willing and able to do it. So again, having some peer support for that, having folks that you can talk about and talk through your experiences is really important, because we do need to be doing a better job of supporting all different types of caregivers. So I do think that's going to change and evolve over time.
And another question's just come in. Do you know of any laws or policies that can support caregivers with job-related accommodations?
Yeah, that's another important thing. So I'm going to get the wording wrong, but yes, the FMLA, the Family Medical Leave Act, guarantees that people can take some time away from their job for caregiving. Unfortunately, the level of financial support that they can get from FMLA is variable and sometimes fairly low. But it does allow you to take some time off, time for leave to care for a loved one. The other thing that I recommend for some people, if it makes sense for them, in New York State, you can become licensed as a home attendant. So you, as a family member of your loved one, can get paid for doing that custodial care, as I mentioned, the feeding, the bathing, the being with that person, by a fairly simple certification process. So that's one way that people can deal with the financial repercussions of having to stay home and care for a loved one.
Okay, very good. We have one more question. I'll read it. It says, my husband needs a walker. He will use it, but he treats it like a car and parks it. And I cannot make him, I think means to say C, to use it, and he has a fear of falling and needs more support.
Yeah, I would explore with it. I mean, so sometimes people feel like it changes their self-image if they're walking with a walker. So that can be something that people are very sensitive about. So maybe exploring with him, what are his reasons for not using the walker, trying again to gently sort of encourage him to use it, making sure it's available for him, might be some ways to encourage the use of it. That's a really challenging situation. Yeah.
Okay, very good. And another question. How would you keep your mental capacity high despite the circumstances? So I guess that means for a caregiver.
Yeah. I think for me, I know that getting some sleep is really key. Like I can manage a lot of things if I've had enough sleep, but if I haven't gotten adequate sleep myself, then even little things can be really taxing, and it can be really hard to manage all the things that are being thrown at you. So if there's ways that you can get adequate sleep for yourself, if you can have somebody come over even for a few hours so you can take a nap, and have just a little bit of time to let yourself process the thoughts and the emotions that you're going through. And I was going to say one other thing, making sure that you have oh, I know what I was going to say. So trying to find some activities, as hard as it may be, to do with your loved one that can be stimulating for both of you. Like, for example, even doing a puzzle or reading a book to them can help. Reading books might help. You can pick a book that's enjoyable to you. They will like it, and you'll be able to think about something that's a topic that interests you as well, to try to kind of combine tasks.
Okay, thank you. So before we wrap up, and if any questions come up, we have Kiara Soto here from Circle of Care, and Kiara's just going to give a short presentation on Circle of Care and the services they offer.
Thank you. Good morning, everyone. My name is Kiara Soto. I am the intake care consultant at PSS Circle of Care, and we are a caregivers program that offers free services to caregivers who are caring for a loved one with memory loss, dementia, or who is chronically ill. These services include counseling support, educational training, support groups, supplemental items, respite care, advocacy, and assistance with long-term care planning. If you'd like to find out more about our program or our services, you can give us a call at 866-665-1713, or you can also visit our website at pssusa.org. Thank you for your time, and I will also be placing our information in the chat box in case anyone wants to take it. Thank you.
Okay, thank you, Kiara. Put that in the chat so people can see it. That would be great. And I don't see any more questions. Any final thoughts? Somebody came in. I'll read that. It says, is there a medical directory that caters to patients with dementia?
I am going to put also a link in the chat, so definitely reach out to Circle of Care, because those are the exact services that I think are really beneficial for caregivers. I'm also going to put, if I can find, here we go, the Alzheimer's Association and Family Caregiver Alliance are other websites that have directories of services. I'm just going to put those in there too.
Okay, well, that brings us to the end. Well, thank you very much, Dr. Chaung, for this great presentation, very informative, and I'm sure it was very useful to everyone. And I would, and hopefully we may send out a, I should have asked you before, Dr. Chaung, if you wanted to send me your slides, we could send them out to the attendees and registrants.
That would be great. Yeah, I'll send you the slides and the flyer for the study.
Okay, very good. So thanks again. I appreciate everyone showing up today. I encourage you to continue to look at the PSS events page for upcoming events. For instance, next week, we have a program on medication adherence. And with that, I thank everyone and wish you a good day.